recording, so whenever you guys want to start, just...
Okay. So, Rob, Dr. Melillo, about this brain integration training.
Yes.
Why do we look at the brain and the nervous system?
It's all about the brain and the nervous system. So everything, every aspect of human behavior, function, every aspect of our life starts with the brain. And I think there's been so much brain research that has come out in the past couple of decades that we're understanding the brain and expanding what we believe the role of the brain is. In the past, people have looked at things like the immune system, the hormone system, the digestive system, as kind of independent systems that didn't really need a brain. And to a certain extent, that's true. But what we now realize is that for them to all function optimally in the most ideal, healthiest way, that we need a brain and we need a very developed and integrated brain. The brain needs to be functioning. If there is an imbalance that most commonly starts developmentally, if there's an imbalance in the brain, then the way the brain regulates the immune system, the digestive system, our blood pressure or autonomic system, all of those things can be dysregulated and out of balance. And so, we can see that it has impact. What we learn from things like the adverse childhood experience studies and other studies that have been done in psychology, we know that when there is disrupted normal neurodevelopment, it not only has an effect on mental health and on education and learning and behavior, it has an impact on one's whole body and can actually even cause someone to die significantly earlier. So it reduces the length and the quality of their life. So it's all about the brain. And I believe that we're going to eventually move to a more brain-centered model of health where we're going to realize that every aspect and almost every disorder, other than genetic disorders or specific injuries but almost any other chronic illness that people suffer from at any age could be explained by a brain imbalance, and probably are most commonly caused by brain imbalances, even though most people don't even think of that at this point.
And when you talk about the imbalance, you talk about the right and the left brain?
Yes, the two hemispheres. One of the things that makes the human brain unique is the fact that we have two very different hemispheres that regulate. They look identical, they function in very different ways. They are anatomically, the brain is not specialized to be the right brain or the left brain. They become specialized based on our interaction throughout our life and our experiences. But ultimately, the right brain is very specialized to do certain things, to respond to certain sensory cues in our environment and in our body, to react and control different motor, sensory, and cognitive functions. And the left brain, over time, develops to be better at certain things. The analogy I kind of use is, let's say you have two identical twins, and one of them really likes tennis, and the other one really likes piano. Now, they both take piano, and they both take tennis, but one really likes tennis better, and the other one spends a little bit more time doing piano. So the one that spends more time doing piano gets better at piano. The other twin is better at tennis. Over time, as they spend more and more time playing piano and playing tennis, they become more and better and better and better. And whereas they may have started out where they actually were equal in their talent or their ability and their genes are identical, based on their use and how they develop their skill, over time, one becomes a professional tennis player and the other one becomes, a professional pianist, and they both are, knew how to or could play tennis or piano, but they're really not very good at it, right? So that's kind of how our brain works. That over time and over development, the right brain becomes better at certain things, the left brain becomes better. And this is a great advantage. We know that our brain is the most lateralized brain of any animal that's ever evolved. And so therefore, it's an advantage. It's like having two brains in one. But with that, there's more pressure that the fact that the two hemispheres act pretty independently, they have to be integrated because everything we do requires both the right and the left brain working together. So there's nothing that is just right or just left typically. Everything is a combination, like communication. When we're speaking, people will say, it's not what you say, it's how you say it. Meaning there's the words that you say, the literal meaning, the verbal component, and then the how you say it is the inflection of your voice, your facial expression, what I really mean emotionally, and that is more nonverbal communication. That's the right brain. You can't have a normal conversation without both happening at the exact same time. If someone's very literal and they don't understand any nonverbal cues, you know, there's not a good conversation.
And that takes us a little closer to if there is an imbalance in maybe, let's say, the right brain. How would that appear?
Well, there's a difference between, all of us have a certain, what we call cognitive style. It's like our personality. We're a little bit more right brain or a little bit more left brain dominant. And so, you know, all of us probably have a little bit of an imbalance one way more than the other. We have certain strengths and we have weaknesses. We have things that we're not so good at, and that's natural. If those strengths and weaknesses are too far apart, because the development of the brain is different, this can create a significant gap between our weakness and our strengths. That gap actually ends up being a disability because it prevents the brain from really being able to be used together and integrated. And as I just said, everything, really we need to get the right and the left brain working together. If they can't work together because they're at different developmental stages or different levels, and what we see is the one that is most problematic is really the one that's underdeveloped or underactive. And so what happens is as our brain is growing, they should be growing about the same, even though one side becomes a little bit more active during different stages. But they should never get too far ahead of one another or too out of balance with one another. If that does happen, then they usually don't outgrow this. This usually stays or even gets worse over time. Once you develop an imbalance, it doesn't go away on its own. And that imbalance is usually reflected by what we call an unevenness of skills. Kids or adults, they may be exceptional at certain things because as one side of the brain is slowed in its development, the other side tends to speed up. So what we see is almost everything, like ADHD, is a combination of too much activity on one side of the brain combined with underdevelopment of an activity or function on one side of the brain. So even the name ADHD, we have an attention deficit. Attention is a function of the right brain, and it's deficient. The right brain is delayed, it's immature, it's underdeveloped, so kids can't pay attention. Hyperactivity and impulsivity is generated by the left brain. So the left brain generates activity and responsiveness, and we get impulses. But when the right brain is deficient, the left brain becomes too high, and we get hyperactive and impulsive or obsessive or compulsive behavior or tics. And so we're seeing, even in the name, the issues are really too much activity from one side and too little activity from the other. But the real problem is always the underactive side that leads to the overactivity. So when we want to correct an imbalance, we have to target our stimulation, our activation towards the underdeveloped and the underactive and specific areas of that side of the brain.
Yeah, in this case, it would be like the right brain.
Like the right brain,
yeah.
right.
And when the family starts, like when the assessment is for the child, and you find a deficit in the right brain, then there's a lot of, the approach would be more like, there's a lot of school issues. Maybe the hyperkinetic part, they are aroused, they couldn't interact socially that well. And then the approach is more like things to do in the school, maybe. And they have to sit still, and there's a big problem in that area. So they start this program where we target the right brain, where we try to balance it out. So can you explain a little about before and after? Before, when you do the assessment and you do the training, so in the family, a daily life, or
in the child, or in the whole lifestyle?
Yeah, the lifestyle.
Yeah, well, that's what we look at it as a lifestyle, because maintaining brain health and balance is a constant effort, right? It's like you always have to brush your teeth or you will lose them. It's not just about achieving balance and then I don't have to do anything. Our lifestyle is usually the main driver to create imbalances. So therefore our lifestyle is the main way of maintaining imbalance or even helping it. So looking at the whole family dynamic is very important, because obviously if we're affecting the mental health or the education of a child, or the way that they're able to regulate their emotions or their behavior or communication, it's going to affect the relationships within the family and within friends and with teachers. And as we change that, we see a change in that dynamic. But we also have to make sure that the environment around them is fostering this change, is promoting this change. If the old environment, and if it was a negative environment, if that was part of creating and maintaining the imbalance to begin with, then even if we do things to try to correct their balance, if we put them back into that same environment, it's going to come back.
Yeah.
So we need to look at, their environment, which is not only, how they interact with one another, but their diet, their exercises, their physical activity, how much computer and screen time. The use of technology is a huge one. People don't realize what an impact that has on the brain, especially on the left brain, with stimulating it and causing a deficit on the right side. This alone could cause ADHD or other types of behavioral issues.
Too much screen time.
Yeah, too much screen time. Because the main thing in kids that really keeps their brain developing and balanced is movement. Motor activity, moving and interacting with other kids and playing with other people, actual face-to-face social communication, touching, sounds, sensory information, climbing trees, riding bikes, doing things like that kids have always done for generations, and now they don't do anymore, mostly because we're afraid to let them out. And so when they're in front of a computer, first, they're not moving, especially their big muscles. And second, they're actually stimulating they're usually stimulating the left side of the brain. When children and childhood is more about right brain stimulation, should be more about right brain stimulation in general, especially for the first 3 years, but even for the first 6 years.
Yeah.
And our whole society is moving so much to left brain stimulation and left brain activation, and schools are all left brain for the most part. So, if we don't give them a chance to really work on that right brain, we may create an imbalance ourselves. So we have to be able to look at the whole lifestyle. Diet and nutrition is a big thing. How much sleep they're getting, what type of music they listen to, even the colors in their room.
Yeah, so it's like a lifestyle-based therapy. But still, if there should be a family thinking, this is too much, this is too complicated, what do you find the most motivating? If you pick one motivator to doing this, to keep on doing this.
Most people, by the time they come to see me or see one of our centers, and mind you, we've worked with almost 40,000 kids and families in our brain balance centers. So we've worked with many, many families. So when a family says, I can't do it, we've worked with 40,000 people who can. So absolutely anybody can do this. It really isn't that hard. But what's hard is living with these issues. What's hard is knowing that your child may struggle, and what we know is a kid with ADHD ends up as an adult with ADHD. ADHD is the fastest growing problem in adults right now. And we know that if you have adult ADHD, your chances of, and even as a kid, the number one risk for a kid with ADHD is going to jail. That's the number one risk.
Yeah.
As well as being addicted to substances like drugs or alcohol. So
We don't want that for our kids.
no,
right?
I mean, who wants that, right? So if you realize that's a big risk, I mean, like going to jail. And when I speak with psychiatrists, many of them, and I ask them, what is their ultimate goal? And they say the ultimate goal is if we keep a kid out of jail. That's it,
Wow.
right? So prison, I mean, that's a pretty scary thing. But also we know that there's a 300% increased risk of substance abuse. They drop out of high school twice as much. 80% divorce rate in families where one person has ADHD.
Yeah, we find that the mom is often really worn out because the mom is trying to keep together the group in the family, the
Right.
dynamics. She's worn out because she has to be 10 steps ahead of the child every day, every second of the day.
Right.
And then we add something on here. We add some exercises daily or 5 times a week maybe, and we add some extra for the diet. So we need to find like a buffer of energy from the mom here, some motivator.
Well, the motivator is that she won't have to continue that level of energy for the rest of her life, right?
Yeah.
Because that's the fact that she has all of these strains, as well as the economic impact. I mean, most families in the United States are spending at least $15,000 to $20,000 a year for a child with ADHD, $30,000 to $60,000 for a child with an autism diagnosis. So, as well as the health impact. And so what we say is, as you're starting to do these activities, it may be challenging because you may be doing things that you didn't do before. It might be harder for the child. But as they start doing it and as you start changing the brain, which can happen very, very quickly, even sometimes from the first session, all of a sudden everything else gets easier. So although you're devoting more time to exercises or other things, the other aspects of the behavior, fighting or problems getting them to go to bed or the sleeping issues or, all of the other things that you had to do to compensate, sitting down with them and forcing them to do the homework. Now they can do their homework on their own, right? They don't need the mom for that. So now the mom may be doing that. But what we also like to do is I like to get the dads to do the exercises because the moms are usually doing the homework and usually doing a lot of other things. And I usually find that we try to get the dads because they usually like doing the exercises or feel like, okay, that's something I can do. They may not feel as comfortable in some other areas of parenting, but they do feel comfortable with being the exerciser. The other thing is bringing the other kids in the family into it. If there's an older sibling or even a younger sibling who's capable, bringing them into it and doing it as a family. And it becomes family time. And I have many families that thank us and say, it was so great, you brought us all together and we were doing these exercises and everybody's getting healthier, everybody's lost weight, everybody's stronger, and then all of these other issues went away. So that's the motivator. People are coming to you because they're struggling, their life is chaotic, they're worried about their child. Quite often their marriages are struggling, their finances are struggling, everything is struggling. And the motivation is, how would you like all of that to just go away? How would you like to not have any of those struggles? Everybody has daily struggles, but what if you would like to not spend an extra $20,000 a year? What would you if you would like to not have to spend all this time and go through therapy and behavioral therapies and do all of these things that you're doing?
And also survival, right?
Yeah, just
Kind of
enjoying
survival,
life, actually
yeah.
enjoying being with your kid, and
Exactly.
really enjoying that relationship. And then doing exercises with them becomes fun. It becomes something that connects you, and it's not this chore that you have to do. So, I don't think there's anything more motivating than, if you're really struggling in an area of your life and it's very hard, just imagine that all going away. Imagine what that would feel like. And that's what happens most of the time.
Yeah, so now we have talked about the right brain deficit, so it's more the ADHD. And we also have the left brain deficit. So if the schools and the society right now is more like a lefty stimuli, maybe that should be an answer, so we shouldn't see a progress in the learning disabilities, but we see a development in that area too. More dyslexia. So how does that interact with this development?
I mean, half of the kids out there, learning disabilities, when you look at the actual statistics in the United States, and this is pretty, from what I found in most of the European countries in the Western world, is pretty similar statistics. About 11% of the population of kids and adolescents have ADHD. 15 to 20% have a learning disability, and 85% of that is what we call dyslexia. So that's actually the biggest single number of all problems that are out there. ADHD is the number one mental disorder amongst the youth. Dyslexia and learning disabilities are the biggest cognitive learning issue, right? And that is actually bigger than ADHD. So that is a big, big problem, but usually learning disability kids are usually they don't have as many behavioral issues, so they're easier to deal with. There's not as much pain usually associated with that, even though seeing the child struggle in school. But many parents are told, well, they're a C student and, they're doing okay, or, well, they're getting by, they're passing, right? I don't think any parent wants to think that their kid is just passing or that their kid is going to be a C student their whole life, and most kids are not. In fact, most kids that have learning disabilities are actually probably gifted, but they have a left brain delay. And left brain delays are language-based delays. And even though school and everything that we're doing and video games more address the left side, it doesn't have an effect because the brain builds from the bottom up. And then it comes from the top down. So the bottom up, there are things we need to look at, like primitive reflexes, motor development, sensory processing, muscle tone, coordination, eye movements, their reaction to sensory stimuli, things like that. And if those things aren't addressed, then top-down activities don't work. They don't have any effect. So that's why kids that have reading problems for many years, the approach is to teach them to read more, give them more help with reading, and it doesn't work. Trying to get a kid to read more doesn't overcome dyslexia. But when you deal with the core problem, it does.
From the bottom of the brain.
From the bottom up,
yeah,
right.
Yeah.
So that's why, even though we live in a left brain society and we have left brain activities, if a kid has a left brain deficit, none of that is actually going to do it unless we get to the core root problem and really address it from the bottom up, which is what basically nobody does.
I agree.
Yeah.
Yeah. Thank you so much, Rob.